HealthBreak is sponsored by Dignity Health Central Coast.
In 2015, French Hospital Medical Center launched its Transcatheter Aortic Valve Replacement, or TAVR program. TAVR is a minimally invasive aortic valve replacement procedure. Dr. Robert Doria, Medical Director of the Cardiac Catheterization Laboratory at French Hospital Medical Center, explains.
It's a big deal because it takes a procedure that historically required a very large operative procedure, an open heart surgery under general anesthetic to replace the heart valve, and now has made it possible to perform without any major surgical incisions. Almost 99% of patients are just done with a local anesthetic, like you might receive if you went to have a wisdom tooth removed and some intravenous sedation. That makes the procedure and the recovery from the procedure much easier for the patient and expedites their ability to both mobilize after the procedure and be discharged home. Usually patients are home on the second post-op day, and some patients are even discharged the following day after their procedure.
The TAVR team at French Hospital has performed more than 105 TAVR procedures and has expanded to do alternative procedures like replacing a previously placed surgical valve.
That's called a valve-in-valve TAVR. We also have now expanded to doing several alternate access sites. So that has expanded our ability to offer the procedure to a wider population of patients.
For more information, visit dignityhealth.org/Central Coast.
HealthBreak was sponsored by Dignity Health Central Coast.